Hey everyone, I'm Lauren Fleming, the founder of Hem Supportwear, and I am here today with another installment of our Expert Spotlight series. Today I have the pleasure of interviewing Dr. Arielle Martone. She is a doctor of physical therapy who specializes in pelvic health during pregnancy, postpartum, and beyond. She's a certified yoga teacher, a certified pre and postnatal coach, a pregnancy and postpartum corrective exercise specialist, and a postpartum nutritional professional who herself is a mom of two. She founded Find Your Way Mama LLC, perinatal physical therapy and wellness to empower moms and moms to be through the whole person care so that they can reclaim their bodies, their confidence, and their well-being to get back to feeling like themselves again. She provides in-person physical therapy throughout the North Shore of Boston, and she offers a virtual holistic postpartum plan. So stay tuned. We're going to get to talk to Arielle. So, hey everybody, I'm Lauren Fleming with Hem Supportwear, and today we have Arielle Martone. She is the doctor of physical therapy, and we're so excited to have her here with us today. So we will jump right in, and I'd love to have you tell us a little bit about your background and what inspired you to get into this work.
Yeah, sure. Thank you for having me, Lauren. And thank you for the work that you guys are doing at Hem Support. I just have to say we are loving your products. So
Great.
thank you for that. Yes, I've been a physical therapist since 2009. And initially, I had an interest in women's health and also an interest in neuro. Ended up loving my last clinical, went into the neuro field primarily for a large portion of my career. And then as I was transitioning into motherhood, which for me was a very lengthy process. It was 5 years of IVF and that whole drama.
Mhm.
But during that whole transition, and then the pregnancies themselves, and then the postpartum afterwards, particularly with my second, was really what shifted me back into my passion for women's health, specifically pelvic health in the pregnancy and postpartum period.
Great. Thank you so much for sharing that. I feel like the more people I talk to in this space, the more I kind of hear this common thread of like it's personal experience that calls them to focus on this. And I
Yeah.
think it's like great in so many ways. And I'm like, oh, I wish that we had, more resources so that people could, not always have to feel called based on that personal experience. It's like such a bittersweet thing.
It is. And it's funny because so I knew I wanted to transition into women's health, pelvic health. My initial thought for that was not with the struggles that I was personally facing, at least not initially. It was
Okay.
more just from a logistics standpoint. I was in neuro rehab. The hours were really long.
Yeah.
It was a big commute. It wasn't really conducive. So I was like, oh, if I do, my other love was pelvic health. If I do that in more
Great.
of like an outpatient type setting, I can have, some more flexibility. It was more that work-life balance that I was going
Yes.
for. And then like I hit my postpartum with my second and I was like, oh no, like we have got to do something about
Yes.
this. This is where I need to be. And so I kind of shifted on from there.
Great, great. Will you talk to us a little bit about what a typical day or week looks like for you in your practice?
Sure. So I'm primarily pregnancy and postpartum. Um, of course, like that postpartum period can continue on for, years afterwards. So it's really
Mhm.
any postpartum related issue or maybe something that kind of flared up in that initial early postpartum period of time that was just never addressed as it
Mhm.
often goes for so many women. So I am 1 day a week in clinic and I am currently doing home visits the remainder of my working time, which I am absolutely loving. And I do try to schedule out so that more of my home visits are for those really early postpartum visits.
Mhm.
If I can get in to see somebody before their 6 week appointment, that is ideal, especially for the women that I've been working with during their pregnancy, but those who've had scheduled C-sections, getting into the home at least once, if not twice, before that first 6 weeks time frame, I find to be crucial for their healing. And then, even for vaginal deliveries, I like to have that touch point within the early time frame to just see how they're doing from more of a
Yeah.
acute care physical therapy standpoint,
Yep.
like all those other things that are so important to our overall recovery that
Mhm.
unfortunately get overlooked. So that's kind of how my day is. I would say currently it's about 50-50 pregnancy to postpartum, maybe a little bit more heavily loaded in the postpartum caseload. But again,
Mhm.
that's because that time frame kind of extends out a bit further.
Sure, sure. When I really liked what you said too about that timing to get in before the 6 week visit. I think it's important for people to hear that because I think a lot of folks, maybe if they're not as familiar with the work that a pelvic floor physical therapist can do, like kind of in your head, it's like, okay, my first check back in is that 6 week visit, and you're kind of on your own, like in that time frame. And a lot of stuff can happen in that time frame, symptom wise or things you might start doing if you're not ready. And realizing that one, working with somebody like you is a really important part of the team. And then two, bringing it in before the 6 week visit is great because, like, for me personally, like, I was feeling symptoms of prolapse ahead of that, didn't know what it was, went into that 6 week visit and was like raising my concerns and was kind of dismissed in that. And it was really
Yeah.
hard physically and mentally because then you're in this early postpartum period, you're checking in with your body and then trying to like seek help, but kind of without those right tools in place at the right time, it can just make that journey a lot more challenging. So I think having that kind of schedule and working with someone like you so early on is just such an important part of that if you can, work that in.
Yeah, absolutely. I find it really gives kind of the power back to the mother who is recovering.
Yeah.
And, I find my role to be, especially in that early time period, very much, an advocate for their health and wellness.
Yeah.
And, to your point, if you are noticing symptoms of, let's say, a prolapse before that 6 week visit, you can be seen earlier than that. And
Mhm.
a lot of new moms don't realize that they can request an
That's a
earlier
great
visit
point.
and do like a 3 week visit and then either a 6 or an 8 week visit. And so just identifying who really could benefit from, I mean, I think we can all benefit from more touch points just
Right.
in general postpartum, but really who can really benefit from that additional visit that they might not know that they can have or that they need. And then also preparing for that 6 week visit of, writing down a list of
Mhm.
questions, concerns, things that you want to bring up because that 6 week visit can feel so rushed and oftentimes,
Yes.
as you mentioned already, you can feel a little bit dismissed and everything is kind of just normalized. Like if your uterus has returned to size and any, stitches that you may have had are healed up, then you are good to go. And
Right.
there's a lot to be, desired.
Yeah, no, and I think the comment you made about writing things down, I think is a really important takeaway because I know for me, like when I would go to kind of any of those appointments, especially postpartum, but also just in general, I feel like, I'll be mentally like kind of noticing things throughout the day or weeks, leading up to it. And then you'll get there and then a healthcare professional will ask you a question and then I will kind of blank or I'll forget things where I'm like, "God, I wish I would have remember that important thing to tell them because in that moment it's a lot of pressure to be like, okay,
Yeah.
characterize everything that you've been feeling. And so I think kind of having that regular check-in and then jotting it down, whether it's in your phone on a piece of paper, like can be a really helpful way to help keep that check-in with your body to be like how are things really. And then postpartum, because it's such a time warp, like with lack of sleep
Mm-hmm.
and the days and nights like running together, it can be challenging to really step back and be like, what is really going on with me other than just like, something's off.
Yeah, and if you're someone who is a little hesitant to speak up in a doctor's appointment, it can be really helpful to just hand them the list.
True. Yeah, great
Because
point.
it breaks down that barrier.
Yeah,
I know a lot of people that I work with, they freeze up, they have concerns,
yeah,
they get embarrassed, and
sure.
your provider, they don't want to be rushed through the appointment. Unfortunately, that
Right.
is how their schedule is set up.
Yeah.
But they do want to hear your concerns. So getting them out, whether you're speaking them out or just handing them a list, is going to be helpful.
Yeah. Yeah. That's a great point. One of the things I like to ask about is like, how do you explain the importance of pelvic health to someone who either has maybe like not a vast understanding or has even never heard of it before?
Yeah. So I like to say that pelvic health is kind of the intersection between our physical health and our mental and emotional health. And that is also kind of it's our foundation as a whole. And we can look at it as our physical foundation when we are looking at, where all of our movements kind of stem from. They stem from the core, and the pelvic floor is a big part of that. But then also because of the more autonomic response of the pelvic floor, how, we're not thinking of our pelvic floor on the day to day. We just expect it to show up for us in the way that it's supposed to. And when it doesn't, we are finally like, oh, wait a second.
Yeah, what's happening?
Yeah, but because there's a lot of that automation that we don't need to think about. There's such an interplay between our nervous system and the pelvic floor, and our emotions, our, structurally, when we look at our posture, how it changes, we kind of tuck tail when we're nervous or uncomfortable, and that can affect the pelvic floor. But there's just so much overlap between the two that I really like to look at it as that intersection, like I said, between both our mental and physical well-being.
Yeah, I love hearing it that way, because I do think, to your point, like where it is like on autopilot, so many people, until you run into something, don't think twice about it. I know it's more recently, I feel like it's becoming more common to talk about, pelvic health, but yeah, I think for a lot of people, it's not until something goes wrong that you're like, wait, what is it? How does this work? And, what are my options for help? And so hearing that description, I think is helpful.
And I think it's kind of a dichotomy too, because on one hand, we don't want to have to think about it, right? We want it to just show up how it's supposed to. But I think we also are a little bit disconnected from it too. And that can lead to some of its own challenges, like personally dismissing our own symptoms that we're feeling and kind of brushing them off. We're normalizing things. And when we're starting to work on it, just bringing some attention and awareness to that area and kind of figuring out what it should feel like, or shouldn't, because we shouldn't be aware of it. Like that's part of being connected to it too, is just having a general sense of like what's going on with our body in general, but especially with our pelvic floor. That whole system, our reproductive system, our bowel and bladder system, the taboo things that nobody wants to talk about. We need to really kind of connect back to that, because I mean, those are vital to our functioning. So kind of creating that awareness, that connection to that, but while at the same time being able to function without focusing on it all the time.
Yeah. And I like a follow-up I have for that is, what would you tell folks who, may or may not be dealing with something, but just kind of like generally good habits for promoting good pelvic floor health?
Yeah. So, I'd like to say like pelvic health has pillars, and since I work with postpartum women, I also work with like the pillars of postpartum wellness. And the great thing is that they very much overlap and connect with each other. And so the things that we want to keep in mind for good pelvic health is, again, because it's that foundation and the intersection of our mental and physical well-being, it's also the same things for your overall well-being. So it's going to be your movement, your sleep and rest, your nutrition. All of those factors play into your overall pelvic health. So if we're addressing those areas, if we're staying hydrated, if we're eating the protein and the fiber that we're supposed to be eating, and if we are moving our body daily to promote digestion, but also to promote blood flow, and to allow the muscles to function, because again, they should be automatically kicking on whenever we're doing specific tasks, and then on the flip side, turning off, that kind of on off automatically going when we're doing different activities. So if you can start to just focus on your overall wellness, which I know it's so much easier said than done, right? Is eat right, get your sleep, drink water, but it really is a good place to start. It starts with the basics and then kind of going from there.
Which I think is helpful, because even though it is hard, it's something that everyone can work on, kind of regardless of where you are. And then knowing that it can change in different phases of life, and some of them it's harder to achieve that in others. And, just knowing that those it will pass, and, maybe the next phase is when you can spend more time on it than maybe you would like.
Yeah. And to that point, like if there's an area that you're particularly struggling in a certain phase of life, then maybe let's focus on some of the other ones while we can't focus on that one. So let's say, I don't know, you had a shoulder or hip injury or something like that, and you're not able to do the exercise that you were doing before, or early postpartum, right? Where you're not back to doing what you were doing before.
Right.
But focusing more on the nutritional aspects and the hydration and the rest. And I like to kind of group like nervous system regulation into that as
Mm.
well. I guess we know, again, especially in the pregnant and postpartum population, we're not always sleeping the 8 hours that
Yeah.
would be ideal.
Yep.
But that's okay. And we can still find ways to support ourselves and to get rest without getting that solid night's sleep. It
Yeah.
sounds impossible, but there are workarounds. We can make it happen.
Oh man, yeah, that's so true. Um, can you talk to us a little bit about some of the common misconceptions that you see in this space that you feel like we need to raise awareness on combating?
Yeah. I would say some of the common misconceptions is that there isn't really anything that you can do about your pelvic floor concerns, that everything is, a lot of our concerns are kind of normalized. Again, especially we'll talk about like postpartum first, but this is true for really, I mean, if you're going to talk about menopause as well, a lot of those complaints
Hmm.
are also normalized. It's like, well,
Yeah,
you're just in menopause. Like, this is what you're going to have to deal with now.
yeah,
And same for postpartum, where if you're feeling symptoms of prolapse, you mentioned earlier, you're kind of dismissed as like, well, that's
yeah,
normal. Uh, and, some variation and some changes are normal. And, we can't expect our body to look and feel the same throughout our entire lifespan. But if it's causing a concern or a complaint to you, there is something that we can do about it.
mm,
And so making sure that we kind of get that out there. Same thing. I feel like the big one too is bladder leaks, like urinary
yeah,
incontinence is so common within that first year postpartum. And then a lot of times, because we know that if we're not addressing it early on and you're still having leaking at like six
right.
or 12, 6 months out, that you're going to have it for a lot longer. It's not something that just goes away on its own if with time. And in fact, it can actually be harder to
Get
treat the
worse,
longer
right?
we let things go on. So just kind of, we want to make people not feel alone,
Mm.
absolutely, but we can't just normalize it because it's a challenge that a lot of people face. I think it kind of highlights the fact that we need to do better for our moms if this is so common. Like, yes, you are not
Right.
alone. A lot of people feel this, and we can do something about it.
Yeah. And here's how we can start to work on this. Yeah, I think that's such a huge part of it because I think you're exactly right. Like, well, one, like a lot of people can feel alone and like that no one else is experiencing this,
Yeah,
or
because
well,
no
this
one
is
talks
just,
about it.
yeah, or this is just what happens. Once you've given birth, then you leak, and it's like those are not the messages that folks need to hear without and here are the resources that you can begin to work through to find out what's going to work best for you.
Yes. Yeah. And that is the key point. What's going to work best for you?
Yep.
Because our pelvic floor functions in a system. It's not, we can't look at it in isolation. Like, I
Yeah.
mentioned before, if you had shoulder or hip surgery, like we can't just look at it on its own. We have to factor
Right.
in the nervous system. We have to factor in your diet, your daily habits, because it all plays in to what's going on to your pelvic floor. So there's not really like a cookie cutter approach to any one person.
Right. Yeah. And I think that's an important piece too, because as we see more um people raising awareness in this space, I think it can be a little bit overwhelming for folks where they see, oh, like this one program or technique or something is like the
Yeah.
thing that's going to be right for me, and not realizing how unique each individual body is. Like, especially like you're talking about, where it's like it's the physical and then it's the emotional and mental and all of that coming together. There's a lot of factors that play that could be driving you might have the same symptoms as someone else, but the way that you each are going to address those symptoms could be night and day different. And I think not understanding that nuance can cause more harm than good when people are trying to do the right thing, but don't necessarily kind of understand what that right thing might be for them.
Yeah, absolutely. And, to that point, like if you've tried something and it didn't work, that not to just kind of give up, that it's just
Yeah.
like that approach didn't work for you, or maybe that approach didn't work for you, how you were implementing it, which is why it's so
Hmm.
important to have somebody else kind of help you through those things. But then
Yeah.
also, every, providers are different. We have different ways of going about things. So maybe
Yeah.
you've tried pelvic floor physical therapy before and you felt like it didn't work for you. But, was that a 15-minute session and you had to like rush out to the gym to finish the rest of it with a rehab aide who you didn't know from last
Right.
week is a different person,
Right.
versus like trying it again with somebody else who you're one-on-one with for a longer period of time. Those things, they matter. So
Yeah. Yeah. No, great point. Can you share with us, if you feel comfortable, a success story of somebody that you worked with that you feel like would be helpful for the listeners to hear?
yeah, sure. um, so I was working with somebody recently who had she had a lot of tailbone pain when she was breastfeeding, but then also when she would, go from sit to stand, it would spike up again.
Mhm.
And those were like the two main complaints. And then as we were like talking through the history, there was some more bowel symptoms that were coming up. So there was like a history of constipation and then also some smearing. And again, that's a common thing that can happen postpartum, that we hear of bladder incontinence all the time, but we can have bowel incontinence is also very common, but not as talked about.
Right.
Um, so hesitant to bring it up, wasn't sure if it was related. It's always related. So if you're, anything that you're like, oh, maybe no,
Right.
just bring it up, it's likely
Right.
related. Um, so we were working together for about 8 or 10 visits. But during that time, we did a lot of pelvic mobilization. We did a lot of manual work. She had a lot of tension in the back of her pelvic floor, and also just from birth and from previous history, tailbone was in a different position. So kind of mobilizing that back into place while working on the muscles as well. So that way, when we can get it back into place, it stays there. Because if there's, because of how things get shifted and repositioned, then our muscles can get tense in certain areas. So we need to like release that tension, work on the mobilization, then build strength in the new range, and kind of go from there. But her bowel symptoms cleared up pretty quickly on. As far as like the smearing and the incontinence, still had the constipation because again, that was kind of a long ongoing thing. But by the time we finished, her bowel movements were regular again. She didn't have pain when she was breastfeeding, didn't have pain in transitional movements, and just
Amazing.
overall felt like a new person because, you know, she just, there's, a little bit of, what do I want to, self-consciousness going on
Yes,
when you're having some
absolutely.
bowel issues, that once those were resolved, kind of just gave her a new outlook, more confidence in how she was moving, how she was doing things. So yeah, and then she got back to doing higher level exercises and stuff as well. So it was great.
Amazing. Yeah, thanks so much for sharing that because I think I always feel like it's really helpful to hear. I mean, there's so many, yeah, for me, takeaways in that, right? Where it's like there's like all these different symptoms that maybe you don't feel related, but that can all be so tightly intertwined. And then just seeking that help and, working with somebody, it's not the forever thing. It's like it's just kind
Right.
of this targeted effort and it can be life-changing for your movement, for your confidence, for all of those things. Um, yeah, I just think
Yeah.
it's so inspiring to hear stories like that because it just
And
hits on so many pieces.
yeah, and for your health long term too, because when you're able to get back to moving comfortably and exercising again, you have all of those benefits of the
Yeah.
cardiovascular health
Hmm.
and bone density that get improved once you're able to get back to the exercises that you wanted to do. And a lot of times, pelvic floor symptoms keep people from doing those
From doing
things.
that.
So
Yeah.
it really can impact your overall health and well-being when we're not addressing these, what people will consider a little problem. So
Right. Yeah.
like, oh,
Yes.
it's
No,
only leaking sometimes when I
right.
run and lift, so I'm not going to do that. Okay,
Right.
but then what? So
Right. No, yeah, that's such a great point. One thing I wanted to ask about is, just with this space being, I think it's changing a lot, and there's new techniques coming out, new treatments, things like that. How do you keep your pulse on, the latest innovations or breakthroughs in this space?
Yeah, so I would say, I would love to say I sit and read a ton of research myself personally, but as a mom of two young kids, that is not how I get most of my
Yeah, mom, business
information.
owner, practitioner.
Yeah. I am a CE junkie, so I'm always taking a CE at, there's not a moment in time where I'm not in the middle of a course on pelvic floor.
Mhm.
So I'm constantly taking virtual ones, and then throughout the year, I'll when I can go to in-person ones as
Cool.
well. I like to listen to podcasts on my commute. My kids get to listen to them too. I'm sure they love it. But Michelle Lyons has an amazing podcast. She breaks down a lot of current research, so I'm listening
Cool.
to that one constantly. And then if there's anything that really spikes my interest, then I can like go back. A lot of times they link the articles, go back and kind of dive
Mhm.
into something a little bit deeper.
Yeah.
But I would say like continuing education courses and some of those podcasts have really been kind of what keeps me abreast to what's going on.
Cool.
And then I'll be going to Pelvicon, which is like big, big
Yes.
pelvic floor
Yeah, that's the big
conference.
deal.
So
Uh-huh.
I'm super excited to be live this year. I got the virtual recordings last year, which is, you get the good information, but it's
Oh
going to be
yeah.
nice in
Yeah,
person.
you don't get all as many of the good feels as when you get to go in person.
Yeah, absolutely.
Great. Cool. Thanks for sharing that. One last thing I wanted to ask you about is, what do you find to be some of the most rewarding aspects of your work?
Um, Honestly, it's the small day-to-day things that I find most rewarding. Is that, you know, a lot of times people come in and they're like, you, you do get some people who have significant symptoms of prolapse that are, greatly limiting what they're doing,
Mhm.
or like constant leaking. But a lot of times it's the people that come in where like, oh, I don't know if pelvic floor therapy is really for me. It's only this small thing. And then as we're working together, seeing like those light bulbs go off of how
Mhm.
interconnected everything is, the mind and the body, and just making small changes, whether it's, some postural adjustments that we're working on, a little bit of strengthening, incorporating that in, changing up a sleep routine, just how small changes can end up making a big impact on their day to
Mhm.
day. I find those little moments to be really rewarding.
Yeah, no, I could definitely see that. Thanks for sharing that.
Yeah.
Okay, as we wrap up, I just wanted to say, is there anything else that you'd like to share with us before we conclude?
No, I really enjoyed my time on here, Lauren. I would,
Great.
well, have to plug your support wear. I would
Oh,
say
thanks.
that that's something that's something that we are recommending to a lot of our prolapse clients, because it's nice to have an alternative, and it's great to have something that they feel confident in the
Hmm.
in between therapy sessions, because we can have a great
Hmm.
session, and then while we're working on carryover and while we're working on implementation, it's really nice that they have something that they're still feeling comfortable and confident in. And a lot of times working on strength can really help with a prolapse, but there's a
Hmm.
hesitancy to working on strength because there's
Yeah,
a lot of fear of am I going to make it worse? I was told I shouldn't be doing this. So
right.
having that support while they're working on building the strength, it's just a big confidence boost. So
Yeah, thanks. No, I know that was like one of my biggest things as I was, on that recovery journey, was just not finding something that made me feel confident in between, where it was like, okay, I know I'm heading in the right direction. I know I'm doing things, but at the same time, I have a baby and then a toddler and like all these things, to deal with and pick up and do. And it was just, yeah, wanting that additional support was really important, and what, really drove me into working on this. So it's great to hear, that folks are finding
yeah,
it helpful.
it lets us as therapists kind of like push the limit a little bit more, because we always want
Hmm.
to kind of get up to that edge of like where we
Right.
can start to build strength. And
Hmm.
when they're feeling comfortable about it, it's
Yeah.
helpful.
Yeah, absolutely. No, that's great to hear. Thanks for sharing that. Okay, well,
Yeah.
thank you so much for talking with us today. I really enjoyed our time, and we really appreciate you sharing everything that you did.
Yeah, absolutely. Thank you for having me.
Thank you so much for joining us for this installment of the Expert Spotlight series. If you liked what you heard, please like and subscribe to our channel. We are here to help raise awareness of pelvic health and have important conversations.